So, everyone, good morning, good evening, good afternoon. Welcome back to another episode of our Go Global Experts, where we'll talk about everything that helps us age better. And today, especially to smile better. So, I am your host, Dr. Mrigna, and we'll be, as always, joined by the ever charming Pankaj. So, Pankaj, baton on to you.
Thank you, Dr. Mrigna, and it is a pleasure to welcome on board Dr. Shalya Anand. Dr. Shalya is based in Netherlands, and presently she is visiting India, and she was the one who spoke about geriatric dentistry, and that is where we decided that this is a important subject matter which needs to be brought on the forefront and discussed in length to a certain understanding. So, Dr. Shalya is quite an accomplished professional. She has more than 30 years of clinical dentistry experience across India as well as in the Netherlands. She has partnered and collaborated with a lot of institutions, academic institutions, and other institutions like Harvard and other reputed colleges. And now she's trying to promote and advocate the cause of oral health and geriatric dentistry for the larger cause. And it's truly a humbling experience to have her for this session. So, welcome, Dr. Shalya.
Thank you. It's a pleasure to be here. I think you're doing a great cause, and it's a good feeling to partner with this and bring oral health for all.
So, I think, Dr. Shala, I must say you have a really bright smile. So, coming from there, my first question to you would be what exactly is geriatric dentistry? We have spoken about dentistry, we understand we need to go to dentist, but what's the difference between a general dentist or
Mhm.
somebody who's working for the geriatric population?
I think it's a wonderful question right now because this clarity needs to be highlighted. So, geriatric dentistry is a specialized field focused on the oral health area of older adults, addressing on the complex needs because they're very unique due to age-related physiological changes, chronic diseases like multimorbidities like diabetes or hypertension. You see any patient that they're eating around 16, 17 tablets a day after a certain age. So polypharmacy, the effect of the medication. So unlike general dentist care, geriatric dentistry requires an understanding of the systemic health interactions, the oral systemic connections, mobility limitations, there are cognitive impairments, and also psychosocial factors which are very common in older adults. So, what I'm trying to do, or what geriatric dentistry does, is it emphasizes tailored, preventative, diagnostic, and therapeutic innovations to maintain oral health, a good function, and a quality of life in older patients.
Oh,
So,
that's actually quite enlightening because so far India being a very diverse country and probably not on the best of oral health habits, I think this is something which is really going to educate and highlight the need for oral care and or geriatric dentistry amongst the service providers as well as the elderly people, the family members, and public at large. Yeah, my query or the question to you is what exactly is the difference between oral health and dental health? Because sometimes or most often to people like me or even my family members, we may be educated but we really do not understand the differences, which I'm sure would be common to a lot of other families. So is dentistry and oral health the same or they're part of it? So we'd like you to throw some light on it.
Interestingly, it's been 30 years since I've practiced oral health. Like I started my practice in 1995. The concept between oral health became clear as time passed. It's something that I've always practiced, but it was only when I entered academia during my two masters in the last 5 years when I realized that oral health is drastically different from dental health. And the whole world just talks about teeth and gums. We go to a dentist only when we have pain. But oral health is not that. There's actually a researched definition by Glick et al., which says that oral health is a very broad concept which encompasses the health of all the structures within the mouth, including our lips, our tongue, gums, mucosa, and teeth in the end of it. But what happens is dental health is just about teeth and gums. So we all talk about decay, we talk about gum disease, pyorrhea ho gaya hai. No, it is also the ability to speak, swallow, to be able to chew well, to be able to taste. Do you believe that oral health includes everything? And I always say this, that in the end of our lives, what do we need to do the best? To eat, to be able to enjoy life. And if at that time our oral health is poor because of oral frailty, there's a big term, we talk about frailty with bone, with our weaknesses, physiological degeneration. But no one talks about oral frailty. Oral frailty is the gradual physiological changes which happen in the mouth. The number of teeth go less. There's dryness in the mouth because of all the polypharmacy, all the diseases. So patients have constant problems because of the dryness. And because of dryness and because saliva can't wash away the tissues, there's decay. So what I'm trying to say is that oral health means includes everything. And it includes key functions like chewing, touching, speaking, and everything is not healthy. So indeed, we are supposed to be taking care of oral health because that affects our quality of life. Dant, though, I've heard it from all my patients saying, ma'am, ek nikal jayega, so it doesn't make a difference because we think that we have 32. But every tooth is important to maintain the balance and good health in a patient's mouth. So that's the basic difference between the oral and the dental health, because oral diseases are also connected. They have a bidirectional relationship with systemic diseases like diabetes, like cardiovascular diseases. There's research which creates evidence that it is connected to Alzheimer's, dementia, and most recently, pancreatic cancer.
Oh.
So there is a relation, and that is why we need integrated care approaches and awareness. People are not aware that oral health is so important. So that's how it is.
No, that's very interesting. And I'll just like to extend this and probably take some cues from my personal father's aspect of it is sometimes when I see, because he had his mouth cancer, so obviously a lot of his one half of his jaw is not there, and when he's wearing dentures, so sometimes when we order food, he says, "Oh, my denture is gone for repairing. I will not be able to eat this food one day." So it's not probably only the biological aspect. It's like you guys are eating, even I want to eat, but I can't eat. So
It's so true. The psychosocial aspect of a good oral health is never discussed. We talk about functional ability of khana, of chewing food. We do not talk about the fact that if a patient has dentures or if he has missing teeth, they go into isolation. What you said about cancer, if I may add, this was my first published paper. There have been 4 now, but it was a topic of my thesis. I spoke about integration of oral health in the treatment of old patients with cancer. So this is the topic that I pursued in my Masters of Healthy Aging and Rehabilitation. And the reason why I did the course was because there was one patient in all my life, that was 26 years before I went for studies, whom I cannot treat. I really did not know because we are not taught how to deal with cancer patients. We're not taught how to rehabilitate them. And I couldn't even find a specialist for him. So I based my entire thesis on that. And that's what I'm focusing on. And you're absolutely right. The psychosocial aspect is a part of quality of life, which again is oral health. It's not dental health, it's oral health.
excellent, excellent. Yes, Dr.
Oh,
Mrigna.
yeah, so I think that's very interesting, honestly, when we're talking about the psychosocial health, of course, that is getting affected, and also the fact that small things like chewing, swallowing, or even smiling affects is being affected in such cases, and how it psychologically affects the individual who is going through all of that can be a really impactful statement, to be very frank, Dr. Shalya. And I understand what you're saying. So there was a advertisement I saw, I think, some years back, whereas there was an image with a man missing an eyebrow and missing a tooth, and it was supposed to be like which catches your attention first, the missing eyebrow or the missing tooth. And for I think more than 80% or 85% of the respondent, it was the missing tooth and not the missing eyebrow.
Yeah. So true, Mrigna. I still remember watching a lecture when I was a student where they put Julia Roberts. My teacher had put two slides,
Hmm.
one with the tooth which was black and then one with the other one which was clean. So we talk about Julia Roberts' smile, but imagine her being without a tooth. So this impact, and when you have cancer, when you have dry mouth, or when you have ulcerations, to be not to be able to wear the dentures causes social isolation, which is one of the biggest causes of loneliness and the decline of the patients. You are working with elderly, so you can well imagine. And this connection has never been discussed. It is never highlighted. So this is my mission in my life, to promote oral health for older people and bring about awareness as a part of
That's, I think,
interdependent thought.
Dr. Shala, it's very beautifully said. And
Mhm.
the social isolation, and when we're talking about loneliness, I mean, there's been a lot of research being done these days talking about, how it's like a epidemic and it's almost as dangerous as smoking 12 cigarettes a day versus blah, blah, blah data. But we aren't talking about some factors or direct factors which are leading to social isolation. If my mouth is smelling bad, or in case, for example, if my oral hygiene is not good, or
Mhm.
my teeth are missing, I cannot smile, I cannot be part of I will not feel comfortable. I shouldn't say I cannot be, but won't feel comfortable being part of a gathering or a social outing where I'll be meeting new people. And that's so true. That's so true. And the fact is, we often see adults, especially struggling with chewing, swallowing, these things that we understand. Okay, chewing, there's a denture problem. But this psychological aspect of it versus somebody getting lonely because the oral health isn't working for them is really, I think, an aspect where we should have a look at.
Not only that, Meghna, you must have seen there are many patients who are hospitalized because of malnutrition, elderly people, because the nutrition is not good. Everyone thinks of many big diseases, gastric issues. This no one believes and thinks about that. This is the door to a body. I always have explained it to my patients that you can have a very clean house, but if your door if there is let's say a cow dung lying at the door, imagine even your cleanest house will have these footsteps and take all the infection inside. And similarly, if you have infection in your mouth, that's going to travel through your own body. And what you said about the infection part, the pain part, the functional ability, the psychosocial ability, no one ever realizes that the malnutrition could be that the guy has, or the guy or the girl or the older person has some ulcers, has no teeth, has a painful tooth. Like yesterday, I did all my a camp in Vidisha. I was there to present, or we had a speech, I spoke about it, and then we had checkup camp for people there. Those people turned out to be mentally troubled patients. So most of them were going through psychiatric medicine, they were taking treatment. But I can vouch for the fact because I was there. 100% of the patients had pain in their mouths. Someone had a hole. He was like, I could not eat. They have pain, they have mobility, they have bleeding gums. But that part is not just taken care because it's difficult to treat them. Dentistry is expensive. The affordability, the accessibility, and the availability. We do have an issue. And especially for geriatric, we don't have trained staff. But we need to start thinking because the demographic is changing.
So I'll like to ask you, Shalya, this
Mhm.
particular one question
Yeah.
because typically when I sit down with my father,
Mhm.
he takes at least half an hour to 45 minutes to finish his meal.
Yeah.
And that also probably just one chapati and a little bit of other food because of the way his mouth has now got structured. So, how important is oral health and geriatric dentistry in terms of swallowing and
100%.
chewing?
That's it, precisely it, because it's oral health. Your tongue position, your lips, your mucosa, they need to be healthy. So what you said, first I'm going to, because I'm a dentist too, apart from a researcher, I'm going to give a very small tip, which I tell my patients. Ask him to put his roti in the dal, soak it for some time before he starts eating, and then mash it with his hand and swallow it. His nutrition should not suffer. His entire protein intake, carbs, vitamins, they should not go down. The malnutrition should not happen because there is a chewing problem. We just need to find a different way of getting all the food in there. But swallowing, if your tongue is not healthy, if you have ulcerations, if your muscles are not good, and physiological decline, that's what exactly oral frailty, because our muscles go weak. So you would have seen a lot of older people with drooling saliva.
Yeah, my father has to wear a bib
Yeah.
because of the operation. So
Yeah.
he's matlab, half the time, half a liter of the thing is falling down. But then there is no other way of
Yeah, so
eating.
there is, yeah, but what I do is I can just tell you some tips and tricks of how he can do it, you know. We say it in Punjabi, roti go ke khana, you know, like you put it in dal, mix it well. Like my father, when he went through some dental troubles, I remember making chicken dalia for him. So no compromises on what, it just has to be the innovative abilities of the cook out here. And if he has it, because there will be drooling, but your father has gone through a major surgery. There are people regularly who are aging who are not able to hold it because they do not exercise their mouths. No one tells them. Pankaj. The issue is the lack of awareness. If people are told that this is what is going to happen when you're going to age, and exercises, mouth exercises become a part of your routine, like you, me, Mrigna still has a long way to go, but we can start doing our exercises now.
So
Healthy
what do
is,
you mean by a mouth exercise? I have to be very
oh,
frank. This
I
is
am,
something.
you'll be very,
Now, I'm also very intrigued, Shalya, about this. Really, we really want to know. That's very interesting what you spoke about just now.
Mrigna, I am coming up with all these things because I don't know whether you checked it or not, but I'm the chair of the Oral Health Literacy Division of the
Yes, we are
International
aware.
Health Literacy Association. So,
Yes.
I'm creating a dental toolbox with Max Planck researchers, and it will be published soon. And for health literacy, also, I'll be creating some kind of content where, and I want to do a study. That's what I'm working on now, and that's why I'm here in India for older people, so that I can give them a very innovative AI-based home oral health screening, like you can do it in your 50SS. And based on the study, I will create contextual, patient-based, co-design it with them. It won't be like those typical four things, you know, brush twice daily, floss your teeth, eat healthy, and go to the dentist 6 months. That's what's been told to everyone. But despite that, we have 3.7 billion people with dental diseases. I'm trying my best within a year. Hopefully, I'll be able to give you an entire structure of what exercises that are needed to be done and put it in such a way so that we can distribute it in old age homes, put it next to the table, next to their wash basins, and they can do it as a part of their routine. Just stand in front of the mirror. Like yesterday in Vidisha, in this old age home, in this place, there will be salt water every time that they eat. It has been, the arrangements have been made that they will be provided with water with some salt added to it so that they can rinse their mouth after every meal. I cannot treat every patient, but we can prevent a lot of trauma and pain. So that's the image.
No, I think that's beautiful. We are eagerly waiting, for this exercise program to come and this plan to come that can really, really, I think, solve because we are a huge number.
Yeah.
That's true as a country. And as a population on Earth, I think we are a lot of people versus the resources of dentists across the globe. I'm talking about it isn't evenly distributed. So having some tool, some kind of a thing to help individual prevent, I think would be wonderful. And I think it has been very interesting, Shalya, when we have spoken about social impact of various situations, the nutritional impact we have spoken about, we have spoken about the psychological impact. Now let's talk about something that always I wanted to ask, somebody, not my own dentist, and I hope he is not listening. But so I really wanted to ask always about habits, especially like in a diverse country like India. Not everyone is using toothpaste. I've seen people like in villages using those neem sticks and powders and abrasive material like charcoals. What's your take on that?
You guys really have excellent questions. Did I tell you that? Very, very well done. So, what I would say is that diverse oral hygiene practices in India, they reflect our culture, they reflect the socioeconomic status of people, and also the educational variations. I don't find them wrong. Toothpaste is a great thing to do, but there are a lot of people who use toothpaste. It's supposed to be done for 2 minutes. There's supposed to be a modified bias technique of how you brush your teeth so that everything is clean. They're supposed to be floss. But people do toothpaste for less than 30 seconds for the jug of the toothpaste, for the taste of it, and they don't clean the teeth. So there are people जो नीम के दातुन करते थे ना, मैंने भी किया है. Like I've grown up in Himachal का एक जगह पे गांव में, Chamba. I was born in Chamba. So I am a Himachal too, and वहाँ पे नीम की दातुन was a very, very not common thing. So you chew on it for a long time before you can actually start it releases those juices. And trust me, today's generation, we are seeing that there used to be 32 teeth. Now, because of evolution and because of the dietary changes, there are kids who are coming up with just 28. They don't have the fourth, third molars at all. So there is a change, evolution, which is happening. So Neem ka datun, which were original, they had these kind of some chemicals that would be released. So it would work. Concept is the habit, the attitude of keeping it clean. So while the toothpaste is used widespread in urban settings, the traditional methods, they have varying efficacies in the rural areas. I'm not going to say that they're wrong. This diversity, it highlights the need of certain culturally sensitive education, which I was talking about, the co-designing and contextual education, which is focused on promoting the awareness of keeping your mouth clean, which is about rinsing after every meals, not going to bed until unless you've cleaned your mouth, maybe with a neem stick or maybe with rinsing of water, maybe with a brush. Because if you use a toothpaste, but with your finger, it does not go between your teeth, it doesn't work. When I'm in Germany, everyone flosses. It's a habit inculcated from a very young childhood. हमारे देश में even there are many dentists who will not floss because it's not a part of habit. But that's what I'm working on too, if I may say, that of how we can get behavioral psychology to work to promote oral health behaviors. So yeah, there is a lot of work going on, but hopefully we get there.
So, just as an extension to this thing, Dr. Shaila, is what are the main challenges or the barriers older people face in getting access to dental care or quality information?
So there are two things. The care, I put it under 3 A's: affordability, availability, and accessibility. So older people are dependent on someone to take them. So they have barriers like they can have physical limitations like mobility or dexterity. They cannot hold the toothbrushes, and all the toothbrushes are made one size fit all. So this has been my dream to create special toothbrushes, which can be designed for people with arthritis, someone who can hold them, someone with mental limitations. So that's something which is still missing in the world. Economic constraints, of course, it's expensive. Dentistry is expensive. And the sad part is that people come to a dentist only when they have pain. And we don't have a choice. If you're coming to us for a root canal or a cap and a crown and an implant, it just goes and increases. But if you take care of yourself and you come to us for basic checks, which is ideal every once in a year, we can identify an issue early in time and sort it out. And good oral habits awareness, again, if we are aware to maintain good oral habits, our teeth are going to last us a lifetime. You know Mahashaji, right? MDH masale wale.
Yeah, of course.
Pitaji was my patient. I made all his teeth. And just during COVID also, he came to me because he wanted to get a checkup done. And he had all his teeth. I just made crowns over his original teeth. So at 97 also, you can have a healthy mouth if you take care of it. I always used to say, Shalu, अब मैं मंजन करता हूँ जो अब मैं क्या कह सकता हूँ कि अभी भी मेरे मुंह में नकली दांत है या मेरे असली दांत है. So it's such a sweet thought, but they were original because he used to massage it with his वो जो उनका मंजन होता था. So massaging action is very important because our teeth are like this and our gums are like this. So there is a space between them, which is natural. When we eat food and we don't brush, food gets lodged there. And that becomes calculus, that becomes tartar, and that is what makes our bones go down. So it's like there's no rocket science there. It's very simple. All we need to do is take care and it's sorted. They won't
No,
be
I
that
think.
barriers. This
Mm.
is the barrier, lack of awareness. And that's why I'm focusing on health literacy. For me, this is the biggest thing which is solvable. I cannot make dentistry cheaper. None of us can. But we can prevent and protect 4.4 billion who still don't have diseases. Why focus on only the ones 3.7? So that's the approach.
No, I think it's a wonderful approach in itself. And the fact is that oral literacy doesn't require education. It's not that only educated can take care of their teeth or can be oral literate in that sense. From my own personal example, like my grandmother, she passed away at the age of 86. And at the age of 86, she had all her tooth naturally there. I remember being a kid, she would peel those sugar cane for us, and give us those
Yeah, I
pieces
know.
to eat.
Gandaria, we used to call.
Bacteria, absolutely. So she would do that for us. And she had one very simple habit. Now that you're talking about it, comes to my memory. She would always rinse her mouth
Yeah.
and brush twice a day. Simplest habits. And
Very
by the way, she was just a sixth grade pass lady. She wasn't like very highly educated or something. But these small habits go a long way. You're absolutely correct about this.
Mrigna, this was my second master's that I did in European Masters in Health Economics and Management. My thesis topic was health literacy as a social vaccine. So I did that for gender neutral HPV vaccination because that's a very topic close to my heart. We are having many youngsters who are getting cancer because of HPV, oral cancer and oropharyngeal cancers, and there's no awareness about it that people can get vaccines. So but that topic, I'm not going to go on that topic. That's not for another time. But for oral health, I've always believed that health literacy is not individual. In our country, especially, decisions about healthcare or to go to which doctor and which not to go to which doctor are made by the community. And how I call it health literacy as a social vaccine. Like I told you this information. Out of it, like yesterday, I told people कि आप गुनगुने पानी में नमक डाल के कुल्ला करो. It was very simple. I told them. So many people came to talk to me after that. कि कितना simple है ये.
Hmm.
Just a simple rinse by the end of the day. It can protect you with so many issues. And if everyone tells 5 people and everyone against transfers it to 5 people, it's like COVID virus. It spreads. The R factor is super high.
I believe it's the oral health virus
Yeah,
that we hope that it
that,
spreads.
yeah, that's the aim. You always got to try. So thank you for supporting me in my endeavor. And that's why when Pankaj asked, I just didn't say no.
My from my side, I have just one last question.
Yeah,
Is
sure.
that is the quality or the strength of your teeth genetic? Because I've seen some people have strong teeth, and even if they don't really take care of it too much, but still they manage to survive. And some people who are like very very religious in taking care of it, they still land up with a lot of issues for the teeth.
So there is a genetic influence, no doubt about that. There are studies that establish epigenetics also nowadays, that a child, even in the mother's womb, gets what the mother is going through. But it's our habits, and if we know that our parents have had bad teeth, it should not say this, hame to hona hi hai. No, it means that you need to be more careful. You need to be very, very regular with the dental checkups and catch the problem right at the bud. Nip it at the bud. Don't let it increase. Because it takes years for a simple cavity to become a deeper cavity, to cause sensitivity, or to go for pain. Regular checkups and habits. Jaruri.
Oh, that's beautiful, Shalya. So before we wrap up, I have a question that I love to ask all the guests that come to our show. Is there any emotional instance or there is a situation that happened in your life that really impacted your life's mission, the work you have chosen, and if you would like to share it with us?
Absolutely. So the fork in my life's road came in 2011, Mrigna. Um, I had my clinic. Everything was great. Life was very happy. And suddenly one night, one call at 12:10 a.m. I came to know that my husband had had an accident. And by the time I reached Bareilly in the morning, he was no more. I was told that that's another story, but standing next to him in the moratorium, I just told him this, कि तेरे कर्म पूरे हो गए. So I'm a firm believer of Shri Sai Baba. I'm also a firm believer कि जो होता है, there is a reason. And जो जैसे ही दुख accept करने हैं, वैसे ही सुख accept करने हैं. So I don't crib, I don't complain. But standing next to Puneet, I told him कि you finished your works in this world. Mine, some duties and responsibilities are still remaining. So from 2000, my daughters were just 5 and 9 at that time. And in 2018, 19, my elder daughter was applying for colleges. And that was the time when I was like, now all my responsibilities are over or getting over. I need to study. Because it was this profession that enabled me to take care of my children financially and also gave me that mental space because my patients are my family. I've never had patients like, because my parents were both doctors. So from them, I learned that Mama always used to say that don't be proud that you're a doctor. Be grateful that God's given you a chance to serve people. So when I applied for colleges, to be very honest, I did not realize that I'll be able to do it. I wanted to do masters in healthy aging. I got health economics, and you cannot change policies unless you know money, that how cost effective it is if you integrate oral health. And that's what I'm trying to do now. So I started doing 2 masters, and that's my journey. God's been very kind. I've been to Stanford to do a workshop, Harvard. I'm a researcher in Max Planck. There's so much to be thankful for. But yeah, and now I'm married. I have a wonderful partner, and it wouldn't have happened too if I hadn't studied. So God always has a plan. And I'm back in India because I studied for this reason. And serving older people because no one else is going to, no, I wouldn't say that no one wants to do it, but it's a difficult region. There's a lot of work which is pending. And as a senior person who's already been in this field for 30 years, I feel that I have a voice and I can use my energy, my time, and whatever I know, not just with theoretical solutions, but being a bridge between academia and clinical world to give simple, actionable solutions. And my vision and my aim is just one, to create a geriatric oral health policy for India. And for that, I've registered a trust, Smile Age Initiative Trust, and I run a program called Smile Age India. So you got me. I was prepared for this question, but yeah, this is my story, and this is what drives me.
I think it's a very emotional journey, and I think also it's a very inspiring journey, Shalya. I hope, like we are feeling very inspired, everyone who's listening to this story, like like you said, let it spread. I hope they also feel the same energy, the same inspiration, the same strength that we feel from you at this moment. So thank you so much for coming here, sharing your wonderful experiences, some emotional, but some highly insightful things. We are so thankful to you. And to our listeners, we are very grateful for everything. Remember, aging gracefully begins by what Shalya said, no? Smiling fearlessly, working towards the goal one step at a time, and makes a huge difference. Small steps makes a huge difference. So thank you so much everyone for listening. I'll pass on to Pankaj.
Shalya, sincerely thanking you from the bottom of my heart that it was not only educative, but it was very connecting and very reassuring that there are good people in the world who want to do something. Yes, business sustainability and professionalism, everything is there, but till the time you don't understand the problem from the grassroots level and the basic level, sustainable solutions will never come out. So idea is that not to directly import technology or any kind of a solution which has worked in one part of the world. India is a very different country, and since you have seen it, it is something which I think all of us will come out of the solution. And I strongly believe, as you said, there is a roadmap for all of us. And I guess that roadmap or the road has met another road which was probably going in parallel with you. But now it's time to join the road and become a bigger river, I would say.
Thank you so much,
So,
Pankaj, because together we can achieve anything. And oral health
yes.
is essential to healthy aging, and that is what we have to make people aware of. So, thank you so much for helping me take my word forward. And hopefully, we can bring Smile Age India. We make it happen.
We will. It'll take time, but it'll happen.
Oh, yes, it's the Digital Oral Health Mission. And if anyone wants to look at it, it's www.smileageindia.com. And we make it happen.
Excellent. Thank you for coming,
Thank
and
you so
really wish
much.
you a great
Thank you.
evening.
Thank
Thank
you
you.
so much. Yeah.
Thank you.
Bye-bye.
Thank you so much. Thanks a
Okay,
lot.
Dr. Meghna.
Okay.
Thank you.
Bye bye.
Bye.